Brush, as I mentioned before. Toothpaste, which is optional. Many people think that they need toothpaste to get their teeth clean. Actually, if you brush with water, it's almost as equally effective. You just don't get the good fresh taste, and that's what's marketed through toothpaste. Be very careful on what you use for natural toothpaste. Some people like to brush with salt. That's pretty abrasive. Baking soda is better. And there's also a product called French clay, which some naturalists use as a toothpaste. You've got to be very careful with it. It's pretty abrasive. And then, of course, there are many, like Tom's of Maine. There are some other brands of quote-unquote natural toothpaste that are available on the market that you can get at the health food stores. Dental floss, waxed or unwaxed, either is equally effective. It's a matter of technique. And I always tell my patients they don't need to floss all their teeth, just the ones they want to keep. Toothpicks, be sure they're the rounded end toothpicks. The flat end tend to splinter, and you can actually get splinters caught between your teeth or in your gum. And then for some of the less obvious items in this dental kit. The previous items are all preventive in nature, while the following are more curative in nature. It would be good to have a mouthwash of some sort, whether it be salt water, hydrogen peroxide, or Listerine. We don't recommend long-term use of hydrogen peroxide or Listerine. They have a pretty bad drying effect on your oral tissues, but they are good to have for short term to take care of an emergency. Rubbing alcohol to have in the kit to sterilize things. Boiling water can do the same thing, and or bleach can do the same thing, keeping a small bottle of bleach. A hot and cold pack. If you do develop an infection and you have swelling, cold can usually reduce the swelling. They make those cold packs that you can buy that you crunch. It's a chemical activated cold pack, and those are really good. They last a long time. If you do use heat or cold, 20 minutes on, 20 minutes off. You don't want to use it continuously for much more than 20 minutes. Dental wax. Anybody that's had braces knows what dental wax is. That can really come in handy if you lose a filling or you develop a cavity, and on a short-term basis you could insert some wax into that cavity to keep food from getting packed in there. A tube of sensitive toothpaste, for example, Sensodyne. Some people develop sensitivity on the roots of their teeth from recession where the gum tissue has lowered itself. It's good to have a tube of that in case that happens, and it can alleviate a lot of that discomfort. Ibuprofen and or aspirin. Both of those are non-steroidal anti-inflammatories. They are really good for reducing inflammation and alleviating pain. There's a product on the market called Kanka, K-A-N-K-A, and it is a little tube of a liquid that has benzocaine in it, and it will also coat wherever it's painted. So if you have a canker sore or a fever blister, this is a great product to have to cover that area so that you can eat comfortably until you can get through the canker sore. Vaseline and Q-tips. Vaseline can be used for a couple things. If you develop cracks in the corners of your mouth, if you've got real chapped lips, Vaseline is great. If a crown comes off or a cap and you're able to clean it out, you can put some Vaseline inside of it and replace that on your tooth, and it will hold it in place. Not permanently, but hopefully long enough to get you through that emergency. There's also a product that's available commercially called Dentemp, and it also will do the same thing. And then lastly is a tea bag, a plain old Lipton tea bag. There's tannic acid in tea. Tannic acid is a natural blood clotting agent. So if you ever split your lip or you've got an area that's bleeding and you can't get that bleeding to stop, dampen a tea bag, hold the tea bag on that area, and it'll go a long way in helping that bleeding stop. And then there's a whole list of natural remedies. I'm going to read a few of them. It is certainly not inclusive. And I'm not an expert at natural remedies, I will tell you, but I felt to be complete in this talk that I wanted to share those with you. Echinacea is good for upper respiratory problems and colds. Green tea is an antiviral, a potent antioxidant. Cayenne is an anti-inflammatory, also a pain reliever. Arnica is an anti-inflammatory, also a pain reliever. Clove essential oil can be used if you've got a toothache. It helps to take care of the pain. Vitamin E oil is good for abrasions, for chapped lips, for sore gums. It's got a real good healing ability. And astragalus is an antiviral and an immune booster.